Okay. All right, good morning, everyone, and welcome to this quarter, September's quarterly IT Town Hall. We'd like to welcome all the people we have here in the room, but also the people from across the UC system. As you know, we've expanded this format to be able to broadcast this live and also record it. So we know we have people from many of the locations, campuses, and health systems who join, in addition to the people of Office of the President IT Services Organization. So I'd like to welcome everyone to today's address. We've got a really exciting lineup for this. As you know, as in the tradition of we've been doing this, we've been expanding the speakers to share more and more about what IT is doing across the system to support our mission of teaching, research, and public service. And so today, you're going to hear less from me, which I know you're all probably very glad, but you're going to hear some great stories about what we're doing across the system in terms of the leadership of the IT function, the ITLC, and this year's chairman, Larry Conrad's going to get up and talk about the agenda and the ambitions that we've set for ourselves. We also have a special speaker in Dr. Mike Pfeffer is here from UCLA Health. You know, Mike is a trained clinician, but also the CIO, and he's going to talk about all the amazing things and the role that IT plays in delivering patient care and how technology is really a transformational agent in how healthcare is changing in this country. Candace Jones is going to get up and she's going to talk about user experience. Again, building on the theme of it takes all of us to make this work and to deliver the experience that we want. And then we're going to have some final questions. We're going to give you an opportunity to ask all the speakers questions at the end of their presentations. We'll wrap up with a few general questions and get you out of here a few minutes after 11. So, but before I turn it over to Larry, you know, for the ITS folks, I think you know, you should have now seen through your managers, the senior management team, and then also the managers group worked on revising our objectives as part of our performance appraisal process to be able to realign the objectives or reset them to work into your performance appraisals and objectives for the next 9 months. A lot hasn't changed in here in terms of the same guiding statement, adjustment on the strategies a little bit, but it really focuses around doing a great job each and every day in supporting the organization, thinking about data as an asset for our organization, innovating and partnering with the business and the functions, and in our case, the campuses and the health systems to bring value every day. I share this with it because it's part of what we want to make sure that our people here at Office of the Presidency, but I know that all the locations, you guys have similar documents, a way of reflecting what's important and what the priorities are. And I think it's also good to share those things amongst organizations because, one, it helps us each understand the other's priorities, but I also think it also shows that it's not always so different between our locations in terms of how we try to articulate what we're doing and where we're trying to go as a function in support of the mission. Okay, so without further ado, I want to turn it over to Larry Conrad. You know, Larry's been with the university just a little bit longer than I have, but has really been embarking on a journey at the Berkeley campus in terms of the transformation of the function there. We've asked him also, and he volunteered to step up that role and really play a system-wide role. Every year, the IT Leadership Council has a chair. That chair really is the person responsible for convening us as a set of peer organizations and aligning us on a path forward. And so Larry's going to come up and talk about his vision for that and how he's been driving the dialogue. So Larry.
Well, thanks, Tom. I appreciate that. And I appreciate the opportunity to spend a few minutes talking about what the ITLC members are planning and targeting to do for this fiscal year. So let's see if this is working. All right. Great. Okay. So basically what I'm going to talk about is the ITLC Leadership Council is really going to focus on collaboration for this fiscal year. Now, there's a lot of things always that are going on. I mean, UC is a big, diverse place, a lot of activity, a lot of exciting things going on. But in particular, we want to try to focus on driving up our level of collaboration across the scale. And okay, I guess I'm going to have to double click this. So there's been a lot of, and I'll talk more about this in the past, but it's not that collaboration has never been important. It's always been important. But I'll go into a little bit of the history, but we haven't achieved the level that we think is needed at this point. We started by developing a new IT vision plan for the system. There's been a lot of historical activity. There's been a UC Trust Fabric. There was a Foundation Collaboration document, both seminal activities that have been done in the past. We spawned 10 different working groups around the system that talk about all sorts of things from teaching, learning, to information security, to procurement, et cetera. But, as I said, we want to put a renewed focus on the need to execute going forward. And I'll go through these in just a little more detail. But budget pressures, what the medical centers are doing. There was a recent VCR-CIO research CyberInfrastructure meeting. There's the UC Innovate initiative. The teaching and learning folks are looking at digital asset management and analytics issues. And we've hired a planning executive to help us with all that. So a few more details on those. So picking out, and it's a one-pager. You said, well, it probably took a couple hours to put that together. It took a little longer than that when you get the diversity of the UC system. But we, after a considerable good dialogue, we did settle on a one-page. And this is, I'll include a couple of quotes and some bullet points. So we'll start with this first quote. The UC Leadership Council, IT Leadership Council members are committed to collaboratively leveraging IT systems and services in support of UC's trifold mission of teaching, research, and public service. And that's not new. But that obviously has to be a key piece to anything that we do. Goal here is to collaborate on IT service delivery, to make decisions jointly, whenever there are compelling reasons to do so. And there are situations where there are compelling reasons not to do so. And it's important to be able to differentiate. Our intent is to act decisively to seek joint solutions when impacts and benefits are clear and when strategic imperatives exist. So I hope you get the flavor of where we're trying to go with this, that we have a strong commitment, but also a recognition that there are individual differences at the institutions, and we have to be respectful of that. Final quote from the planning document is the ITLC recognizes the value and promise of additional collaboration and pledges to continue to devote significant attention to it. Now, the audience for this document, candidly, is primarily ourselves. So this is a commitment we're making to ourselves and we're making to each other. And that's what's driving us forward. There we go. So a little more on the historical perspective. As I said earlier, there's been work going on for some time. When I got here, I was impressed that this UC Trust Fabric had been in place really for several years. And when you look at the details on it, it's clearly was an impressive piece of work. To be honest, we haven't used it much. So that's one of the issues. The Foundation Collaboration document that was developed around 2012. Also, very nice document. Outlines, just at a fairly high level, things that we could do. But again, that was 2012, 2015. When you look at the things we're actually doing, there's some, but it's not an overwhelming amount. The 10 working groups, there's a lot of talk that goes on. These people meet face-to-face periodically, have conference calls, compare notes and the communication, and that's all good. But again, I think one of the things that the ITLC members have come to recognize is with all that activity, still when you look at what's being done between the institutions, it's not a lot. So one of the pressures obviously is budget. We've had unprecedented budget cuts. I'm sure I don't have to remind any of you of that. The current tuition agreement is good. We have that. It's good to have that in place, so we have a roadmap going forward. But it does tightly limit what we can plan for and expect for increased funding from students. Certainly from a research standpoint, federal sequestration is our current reality. And I don't know, I can't speak for all campuses, but I can tell you that at Berkeley we've seen a definite downtick, not huge, but noticeable in the funding level, and sequestration is the primary cause for that. So we don't expect to see a lot of further growth, at least in the near term. Fundraising. You know, we've got UC has some great alumni, and they're very supportive. Alumni campaigns, I guess certainly for Berkeley, they just finished up one when I came on board. They're getting ready to crank up another one. You know, there's only 2 phases for fundraising. You're either in a campaign or planning for the next one. So we're planning for the next one, and they've had great success. But, you know, people don't want to give money for ongoing operations. They want to give money for something, you know, building or a program, or, you know, maybe if you're lucky, you know, funding a named faculty chair or something like that, but not for ongoing operations. Additional state of California funding certainly seems questionable at this point. Demand for IT resources are up across the board. I don't know anybody anywhere in the country who isn't saying that. And certainly at all public institutions that I know of, the institutional resources are down. So demand's up, resources are down, not a good trend. So what do we do about that? Besides click the clicker. Okay, there we go. So, you know, nice generic statement. We must find a way to stretch the resources that we have, because we can't expect that we're going to get more. So, renewed focus medical centers. The Affordable Care Act is working. It's forcing healthcare consolidation, cost reductions. Med Center leadership has approved a program of collaboration for their IT programs. They are currently assessing opportunities and options. I don't know if Michael's going to talk about that, but you know, it's a pretty aggressive program, including outsourcing options. It's being coordinated by all of the Med Center CIOs. So I'm not sure what I'm supposed to be pointing at here. Of course, it's all in the wrist, right? Okay, thank you. So the fundamental question is, if the med centers can do it, why can't the universities? Research cyber infrastructure. We had this summit meeting back in March. It was very good, well attended. I think everyone that I know that went felt that it was really inspiring to hear from researchers directly about what they're doing, which is an exciting set of stuff, by the way, across the whole system, and what they need. So the president kindly gave us some videotape remarks and firmly supported the idea of a joint planning effort in support of the research mission. The summit data storage was a key discussion. Research data management more broadly was a key issue. And interestingly enough, there was a lot of talk about a so-called concierge feature or capability. And the basic idea there is to get, you know, a researcher at this institution connected with a researcher at that institution so they can better collaborate. Or in some cases, you know, there's a capability at institution A and there's a need at institution B. How do we put those together? So we think there's going to be something useful come out of that. There's a steering committee to plan that, and they're coordinating creation of a roadmap document, which hopefully you'll all see later on this fall. That's being coordinated by Chuck Rowley, the CIO down at UCR. So Innovate is location-led, UC-sponsored. It's intended to be bottom-up rather than a top-down thing. Let's go find out what sort of things are happening out there and see if we can interest some shared services across the system. There we go. The idea, again, is to harness technology innovation at each location and again, leverage each other is the key aspect of this, particularly on administrative systems. So take good ideas, single location, turn them into shared services, and that's being coordinated by Gabe Yotzi at ANR. Learning assets analytics. The problem statement here is that you know, the increasingly digital nature of teaching and learning, there is fuzziness. You know, particularly when, you know, increasingly people are using cloud-based services. We're certainly doing that at Berkeley. Who owns those assets? What are the rules of control, use of those access, and the control of and use of those access, that access? And what about the student analytics that are inherent in a learning management system? What are the restrictions on that? It's not clear. So the teaching and learning group, the ETLG, was one of those 10 work groups of the ITLC, has recommended we work as a system to try to address that, and they're working on some options right now. And then finally, so how do you move this forward? Okay. One of the things as we talked to each other, we sort of came to recognize, well, basically, everybody's heart's in the right place. We all want to do the right thing. But, you know, you go off, you have discussions, you have a meeting, then you go home, and the crisis du jour just takes over. And, you know, having the bandwidth to spend time on this is a major problem. So basically, we came to this idea that, and with Tom's help, we created a new senior level position, the IT planning executive, envisioned really as a fact-finding and brokering. Or first of all, you got to find out what's out there, and then find out, you know, who's got areas of excellence, who's got areas of need, and there's a certain brokering. Again, we put, you know, institution A with institution B, or institution A with B and C, and B and C and D, whatever. It's not an invention, or it's intended to be in concert, of course, with our IT vision document, but it's not envisioned as a one-size-fits-all. And there's a certain level of, you know, identifying and creating coalitions of the willing. Michael Dula is filling this role, has been on since July 1. So stay tuned on this. What we've outlined is an ambitious agenda. It's a break with how we've operated in the past. We do have an opportunity to seize the initiative and demonstrate that the UC institutions can, in fact, work together. If we don't do that, then what are we going to do? And that's an open question for all of us. Stay tuned. Right. Is there time for a few questions?
There is.
Okay. Okay. So, are there any questions? Yes.
What all the 10 committees have formed?
Oh boy, you're going to test my memory.
Sneezy, dopey.
So we do have, and I won't get all the names right, but obviously there's teaching, learning. We just formed a research a group. We hadn't had one. We've done that in the last year. There's a procurement group. There's a security group. We've got an architecture group. Geez, I'm halfway there. I'm got to crowdsource this a bit. Yes?
Accessibility.
Accessibility, right?
Communications.
Yes, of course, communications. So we're up to 7. We're getting close. Any other shout-outs from the crowd to help me with that? It's on the website. You can go find that. So, yeah, but it's a good set of people, and it's a cross-section. Yes?
Can you mentioned collaborating and times when it may not be necessary for the groups to collaborate or share. Could you just give some examples of that, some institutions within the UC system that have collaborated and kind of collaborated?
Well, I'm not sure I can give you any history because I don't have a lot of history, but, you know, I'll pick a sort of an obvious one, but, you know, the things that institutions, I mean, there are some levels of things that everybody's interested in, okay? Communications, okay? Data centers. Everybody has those kinds of issues. And I think, for instance, when we saw from the research summit, you know, there's a very common set of themes from the researchers, as I mentioned, storage and data management and such. But there's, you know, other areas. I mean, for example, if you take a school that's interested in, well, I mean, you know, A&R, and I'll just make this up. A&R's got a whole set of things that they do around the state. That's part of their, you know, that's part of their mission. That's, you know, that's their environment. Well, you know, Berkeley's got some labs, but we don't have to have that kind of a statewide mission. So you have in the same way. So you have, you know, some differences in mission or difference in focus, or, you know, Berkeley has a higher level of research focus than, say Merced, just to pick on someone. You know, so the things that are going to be of driving interest are going to vary a little bit as you move from institution to institution. Yes.
You mentioned shared services. Are there any initiatives that are in the planning or in pipeline?
Shared services that are in planning.
Yeah.
Well, we've got, actually, that's a key piece of what we're hoping to see come out of our development in the UC Innovate, UCIT Innovate initiative. Gabe is in the best position to talk about where that sits at the moment. I do know they're going to have a meeting here in a few weeks where there's going to be an update. I know, for instance, one of the things that Berkeley does, for example, is we do some production control that's being used by some of the other entities. You know, is there a menu yet? I would not say there's a menu yet, but this is the kind of thing we want to work on. Okay, are we about there? Okay, thank you very much. I appreciate it.
So I'll help a little bit on that last question, which is, Larry referred to the UCIT Innovate group, which is kind of spawned out of some conversations about how do we create a more bottoms-up approach to shared services. We have PATH, and I'll say that, one of the things with PATH is it's moving us into the shared services world in a way that we've never been challenged as an institution before. If you look at the delivery of IT services around PATH, we're going to have really a working collaboration between IT resources from the Office of the President, Berkeley, UCLA, and you could even say Riverside in support of the PATH Center. So here all of a sudden in a world where we're rolling out these systems that are used by multiple locations, we're leveraging the talent of 4 locations to deliver that IT service, and it has to work seamlessly for our business partners. So we're being pushed into this world. To plug UCIT Innovate, because I love the idea, because it is, as Larry said, bottoms up. This is a group of people saying, we could do peer-to-peer shared services where it's a grassroots movement where someone who's doing really, really good work wants to promote that and let others look at what they're doing and potentially join into that party. And so what we're trying to do is to turn that into a framework and a repeatable process. We're calling it the playbook, so that anyone who wants to look at doing that actually has a starting point and doesn't have to start from scratch and learn all the lessons that those have been doing it. We're trying to gather the knowledge and give someone a playbook for that. So it gives us a top-down and a bottoms-up approach, which we think is what's necessary to respond to the level of urgency that I think that Larry talked about in his presentation. That funding dollars are harder and harder to come by, regardless of the source. We have to figure out a way to stretch them further. And the university is asking more of us as IT professionals each and every day, each and every week, each and every month. So I think there's a lot of exciting things, and really appreciate Larry's leadership to drive this conversation with really a different sense of urgency than what we've seen the past few years. All right, so turning it over now to Dr. Pfeffer. One of the things that in my role, I get to look broadly across the university. Many of you know I have a healthcare background before coming to the university, and am very close to the mission of patient care. Larry Conrad talked to how the CIOs in the medical center side have been really pushing the conversation. Much of what Larry talked about in higher education is also true in healthcare. I would say it's even been accelerated because healthcare has been doing it a little bit longer in terms of IT playing a more transformational role. And we asked Dr. Pfeffer to join us for this town hall to talk about the UCLA experience in that. So, Mike. You want to press on this key here to go forward.
Got it. Thanks, Tom.
Oh, and just a reminder, when questions do come in, we got a message from the audience, please repeat the questions for the people in the virtual audience.
Thanks, Tom. This thing is powerful here. So thank you for having me. And I'm really excited because I get to talk a little bit about the why do we do what we do. And one of my favorite movies, Lost in Translation, I'm hoping a lot of people have seen it. There's a great scene in it where Bill Murray's character is a washed-up actor, goes to Japan to advertise for a Japanese whiskey. And so they're filming this commercial, and the director talks for like 15 minutes in Japanese, and then the translation is turn left. Okay? And if you think about that, the words kind of can lose their meaning. And if you think about data and information, words and meaning. So you have all these pieces of data, and if they don't get translated properly, then the information at the other end doesn't work. So how does that work in healthcare? Well, up on the screen here, you see what I call fractured health IT, where patients' data is placed in different systems, even the old paper chart up on the right side over there. And it's very hard then to put all that data together and get the information you need. And so this got me really excited because as someone who's really interested in health IT and a physician, I would love to have all the data there so I have the information I need to take care of the patient. But what gets worse is patients don't stay within one health system. They travel. So now you've got this problem at 6 different, say, health systems that the patient goes to for specialty, whatever. And the information, the data, doesn't make it. And so physicians are trying to take care of patients, but there's a big barrier in place. The information doesn't flow. Now, what if you had a patient-centered healthcare? Well, now all of the data for the patient is in one system. And so that's what we have at UCLA and really all of the UC medical centers. We all have this. We have a patient-centered electronic health record where all the data from our medical center is in there. So when the patient goes from the primary care physician to the specialist can see what the primary care physician is doing, vice versa, information flows. It's great for the patients. And then you can then expand that across health systems. And that's the story I'm going to tell you a little bit about today and show you how powerful it is. But information can be exchanged between these centers now electronically. We weren't able to do that when we had a fractured healthcare IT infrastructure. So I'm going to tell you some patient stories, and we'll see what kind of benefits we can get from this sharing. So a 56-year-old female who presented with syncope, so they basically passing out, and back pain, who had an ER visit the day earlier at an outside hospital for similar complaints. These are actual quotes from doctors, because I asked them, tell me how you're using health IT to improve patient care. And the doctor said I was able to pull up the records from that other ER, out and outside hospital, in real time, and decided not to repeat the CT scan of the brain. So as a result, her length of stay was decreased and she was able to get a referral and follow-up. So I'm going to keep score here. That's -1 CT scan. So that's a savings of 10 millisieverts. What does that mean? Well, radiation from radiologic exams is actually not benign. And in this case, a CT scan of the head increases your risk of cancer 1 in 2,000. So it's not quite as it's not quite as high as, say, smoking, certainly not. But if we can save this person a CT scan, we can not give them the radiation that could potentially end up in cancer. What about this patient, a 60-year-old male who's a Kaiser patient, presented with tachycardia, so fast heart rate, and chest pain. And he was seeing the Kaiser ER on a daily basis, so kept kind of coming back for these things. And then after our doctors reviewed the records of stress tests and cardiac catheterizations that were recently done as Kaiser, they decided not to pursue further stress testing and cardiac catheterizations. And so they were able to fill his medicines because they could see the medication list and then send him back to their primary care doctor. So -1 cardiac catheterization savings to the healthcare system of $7,000. Okay, so far so good. What about this? A 77-year-old male who had a renal or kidney transplant, and we're one of the largest transplant centers in the world, really, presented with acute kidney injury. And he came in from an outside hospital, and a lot of times the outside hospitals will send paper records, but they're very incomplete, and you can't read them. In the old days, now they're electronic, so you can at least read the typing, but it's missing a lot of labs and such. So what they were able to do is access his records electronically in real time and defer repeating ultrasound studies and basically go straight to biopsy without delaying care. So we saved 2 hospital days. So the patient got to go home earlier and be with their family. One more story. 72-year-old male, actually seen at UCSF in Stanford, came down to UCLA and presented with altered mental status again. And because we were able to get the records in real time, We didn't need to get an MRI, lab tests, and other things because we were able to see these records. So instead, we were able to get the patient more directed, effective care and decrease the hospitalization stay. So what did we gain? We gained 3 hospital days. And because our hospital runs at 110%, there's people boarding in the EDs all the time. So we were able to move people up from the ED into rooms more expeditiously. So in case you weren't keeping score, I was. If you see, in a fractured health IT world, score doesn't look too good. But in the patient-centered health IT world, which is the world we live in now, score looks pretty good. And I showed you 4, but at UCLA, we've exchanged 253,000 records since we went live March 2013. I showed you 4. If only 10% of those resulted in one of the things that I showed you, that's still quite a large impact on healthcare savings, on throughput, on reduction of unnecessary tests. It's really incredible. And this is made possible by health IT. So even he would drink to that. The other thing I wanted to touch on from the patient standpoint is we have a new customer. We've always been providing services to our clinicians, our staff, our faculty, but now we provide services directly to our patients. So this is a whole different kind of way we need to look at how we manage IT. So let me just show you a little bit of data on patients and literacy. 90 million adult Americans have limited functional literacy skills. And if you look at a study of 84 medical patients at an academic medical center, 44% of them had inadequate health literacy skills and 50% had cognitive impairment. What if you asked 47 patients what their medications were? Well, 27 or 28% could list all their medications. That's it, 28%. And only 37% could explain why they were taking them. And 42% could tell you why they were even in the hospital. So more than half of the people didn't even know why they were in the hospital. And if you look at this study, 250 patients, and their physicians were interviewed, 32% named one or more of their hospital physicians. So almost 70% didn't know who was taking care of them. 60% could name their nurse, so that's at least a lot better. There was disagreement between the physicians and the patients on what they had to do when they leave the hospital, quite often. And then almost 40% of patients and physicians disagreed on what they thought their length of stay of the hospitalization was. So lots of translation issues, right? So this is a great scene in the movie. This wonderful elderly patient is talking completely in Japanese to Bill Murray's character, who can't understand a word of Japanese. They go back and forth, and clearly none of them can understand anything. But you could make that patient the doctor and Bill Murray a patient, and the doctor and the patient talking back and forth would have no idea. Just like if I started talking to a bunch of doctors about DNS and WANs and all the stuff that we know, they'd have no idea. So it's not just Japanese and English, it's medicine to people who haven't trained in medicine, it's IT speak to people who haven't trained in IT speak. So what can we do about it? Well, we have a patient portal. And the idea behind the patient portal is it allows patients to access their information, their discharge summary, their after visit summary from seeing someone in their primary care clinic, their labs, their medications. So they don't have to remember things that are very, very hard to remember unless you do this day in and day out. And look at this, 177,000 patients have activated on our portal since we went live. Those directly interface with the IT staff. These are our customers. How many customers do we have that are non-patients? About 20,000. So we have way more customers that are patients now than we do our own staff and clinicians. It's pretty incredible. If you break down some of the demographics on the patient portal, it spans all ages. Not surprisingly, women are more interested in their healthcare than men. We know that. And but we have a couple 90-year-olds and above accessing the patient portal. And the interfacing of messages between physician and patient and their staff, 56,000 messages exchanges just in August, 1 month. And 250,000 tests were released to patients just in that month alone, so they could see and understand, because if you click on a test, it tells you what it's for. And 8,000 appointments were requested or canceled. And basically, since we had the whole thing go live, over 500,000 messages basically were exchanged. Now, there's other patient-focused technologies that help with the patient literacy issue and the communication issue to prevent being lost in translation. So we have a new tablet that's coming out. It's called MyChart Bedside. It's up here in the corner, which will basically have pictures of all the patient's doctors while they're in the hospital. So we give the patient the tablet. They can see who's taking care of them in real time. Because remember what I told you, only about 30% knew who their doctor was. So we have mobile applications. So we have, you can access our web portal through the mobile app that we have there, but there's a lot of mobile applications that will be coming to interface with the electronic health record. We've got physiologic sensors coming, so you can monitor people's EKG and heart rate from abroad. Electronic questionnaires, so you can fill out information for your physician before you even get there. And then finally, open notes. And this is actually really exciting. We were piloting this, but basically when you leave the physician's office, their entire note that they wrote about you will be visible in the portal. So you can actually read what they are thinking about you, which is amazing. And when there's been some studies looking at open notes, and obviously patients really love it, but they feel much more connected with their healthcare because they really understand and have a chance to read and reread what the doctor was saying. So, there's always this idea in healthcare that you have these patient advisory councils. And basically what you do is you get some patients together and you talk about how are things going in the emergency room? How are things for our pediatric patients? So it's something I did when I took over, and this is a quote out of one of the Scottsdale Institute's publications from our Chief Patient Experience Officer, Tony Padilla. Basically talks about the fact that we started a patient-focused technology council. So what we did was, we got patients together to talk about IT, and we're staffing it with our IT teams. So we go to them and say, here's some technologies, what do you think? Here's what we have, is this working for you? They're our customers now, so we need to have a patient advisory council, not just the clinicians. And so we're really, really excited about that. We've had 3 sessions, they meet quarterly, and they've been incredibly vocal about how they would like to see technology influence their healthcare. So can we get to the point where it's just so crystal clear that no more information is lost? And I think we're getting there. And if you see this sign, this was actually taken from the Great Wall of China. So I guess someone was hit by lightning while they were using their cell phone on the Great Wall of China, hence the sign. But if you look at the sign, it's not only in English, it's in Chinese, which you would expect, and there's a picture of a cell phone with a line through it and a little electric bulb. Pretty clear, right? That's where we need to go. Thank you.
Mike, thank you. So, Mike and I were talking a little bit this morning when he got in, and I was sharing with him an experience. There's a lot of talk in healthcare about what the word that gets used is outcomes. We need to focus on outcomes. When I'm at our campuses now, I hear our people talk about we need to focus on outcomes for the students. And, it just strikes me in my role, and I encourage people always to talk across boundaries, that there's so many similarities between healthcare and higher education that in many cases we think that we're completely different, but they're not, because we're both focusing on outcomes. It's just who the person in the middle of the equation is for us. I think the open notes concept in terms of, we have students now who go out and rate my professor, and before they sign up for a class, look at their professor, look based on shared information. I'm not sure professors have the same collaborative, well, let me look at how this student, what we know about the student when the student's going into my class. But as we get more and more information and going from data to supporting information for whoever's trying to help that student with their outcome, it brings some interesting possibilities and cross-fertilization conversations I think will be a part of our future. So for those out in the virtual audience, when you have a chance to sit down and go to a meeting with members of the health system or health system people with people from the campus, take advantage of it because you have more in common than what you might originally think. So building on that, Candace is going to come up and talk about user experience and some work going on with Apply UC. Part of her title was It Takes a Village, and I think the theme of today really is that we are a village here in the UC, and she's going to share with us something that applies to all the campuses.
All right, thank you guys. It's funny, it takes a village, and yet no one in my village likes to present. So usually I get the heavy lifting on this part, but there's a lot of people who are working on this project, and I'll tell you a little bit about that. Is this the clicker? All right, so what do we mean by user experience? Because it's sort of a term that's been bantered about, user experience, right? So what do we mean by that? User experience is really focused on the user's needs and when they're working with an application or a system. When I started here at Office of the President about 3 years ago, Patrick Rogers, I'll pick on him, he sort of gave me the skinny, right? I know what a user experience is like. No, you really don't, and let's learn about it together. And so we have really tried to embody that in the work that we're doing on a daily basis as we're thinking of our development projects. It's really important for us as IT professionals. We tend to know and do, right? I know what our users want. I know what they, let's put the button here. And so we've taken a step back to better understand and allow our users to actually advocate for themselves and tell us what they want. So it's really about what users feel, what they think about, what they do when they're interacting with our systems. And a user experience has what we call 5 elements to user experience. One is usability. So how easy is it for our users to accomplish a daily task or be efficient about that? And error-free. So how easy, and it's error-free. Accessibility. Are our applications accessible to those with disabilities? That is a part of user experience. We need to make sure that users are able, with disabilities, whether they're using screen readers, whether they have mobility issues, whether they have cognitive issues, that we are actually preparing a user-centered approach for them. A language. The language that we use is very interesting, right? It's language that means something to us, but may not always mean a lot to our end users. So the language and the choice and how do we have the common vocabulary with the audiences that we are rolling these applications out to? Design, does the design actually visually help someone progress from point A to point B? And then the context in which they're using our application. What we mean by that is just where are they using this application? Are they in a library? Are they at home? What devices are they using when they're interacting with our systems? That's a context that we need to take into consideration as we are developing applications. All right, so we have employed this process, this thought, for a very recent initiative with Apply UC, which is the undergraduate admissions application. It is a shared service. We receive all of when kids apply to UC, they do it here, and we send out data and share that data down to all of the campuses. But we presented over the summer to the admissions directors who wanted us to take a step back and our partners here in Student Affairs to really understand what we're delivering to our students, those who are applying. So, of course, we've embodied our, this is the project team for the user research portion of that. And these are all pictures of us when we were applying as bright-eyed students. So Han-Mi Yun-Woo is our project sponsor. She works in student affairs here. And then we have a cross-functional team. So external relations is heavily participating. So the UX piece with Matt Glass, Corey Mahoney, and Ann Greenfield is our project coordinator. All right, so let's get what we focused on and what we were committed to is making sure that the application is a leveler. What do we mean by that? It should be just as easy for students to apply who don't have help at home, who may not have a parent, who may be first generation and may not have a parent who can help them get through the application process, who may not be able to meet with their counselor to help them get through the application, who may not have the same language. English may not be their first language. And we wanted to make sure that we were not putting any unintended, because we never intend to do any harm to our students, but any unintended barriers to the application process. In addition to that, so that's our first guiding principle. Second, say the admissions directors need really good information and understanding and context so that they can make good admissions decisions for their campuses. So that is sort of what led us to go down this path. So we started with a research process. Because again, we think we know what we know, and when we get in there, we're like, well, I had no idea. So we did some online surveys to a previous applicant cycle. We did some user testings. We sat kids down at a computer and said, go accomplish this task, tell us about it. In-depth interviews with our student populations and parents and counselors. So it's not just the students, but people who support that population participated in this process. We talked to our help desk and interviewed them about what were the common questions and things that were coming up, as well as information that we have in the application data. So we wanted to make sure that our data was in line with our application population and pool, so we felt really good about our sample size and representativeness in terms of who normally applies, and those broke down fairly easily with our interview process. We interviewed high school, transfer, Californians, non-Californians, international students, first generation students, and a range of students in different income levels, because we wanted to make sure we had a real good perspective. All right, so 2 surveys went out to people who applied to UC and people who actually bailed on the application. They started an application, and for whatever reason, they just didn't finish, and we don't know why they didn't finish. So we wanted to get some information from them. We had over almost 1,200 applicants respond to our survey, about 720 respond non-applicants, people who didn't apply, which we were really happy with our response rates, because honestly, the people who didn't apply have no incentive to help us, right? They have no incentive to help us, but they wanted to, so we were happy about that. So we did ask some questions about context, environment, who helped them, difficulty with different sections in the application. And what some of our key findings was just how many times do they sit down to complete the application, right? Somebody just going in on November 30th and starting an app, probably, there are a few that do that. But mostly, the kids are taking anywhere from 2 to 4 times to sit down and actually complete the application process. So that's important for us to know as we're developing features for the application. We wanted to understand what devices they were commonly using. Most were using laptops, some desktop usage, smaller on smartphone and tablets. Again, this information helps to inform us as we're building and thinking about how to plan for the next generation of the Apply UC project. And last, where did they fill out the application? Most filled it at home, but some at school, and very few in the library. So again, it's important for us to understand that. Who helped them with the application? Mostly with our first generation students, highly reliant on their parents, or not highly reliant. First gen, not highly reliant on their parents. They have no one at home who has that context, so they highly rely on counselors or teachers to help them through the process. Whereas our non-first generation students, parents they're like, let me tell you how to fill this thing out. So they very much have a lot of support at home, and it's important that we know that. Why? Because then it's important in terms of the language that we're using when we're communicating to all of these populations, right? These are 17-year-old kids. And sometimes, again, the language that we use is sort of like legalese, right? It's like that UC speak. It's very academic, and yet these are 17-year-olds who actually, this is the gateway to their future. I mean, this opens possibilities for them that they never assumed that they would have just by getting accepted to any one of our 9 undergraduate campuses. What we do here is, these are what in user experience that we call personas. So what we're trying to do is to help people understand that users are people. When you see a face, you feel something differently than just me talking over the last 5-10 minutes about users. And so we create personas, and our personas are Valerie, Gianni, Sonia, and Jasmine, and each of them have a different perspective that they bring that we wanted to talk about as they interacted with the application. One step further with personas, so this is an example of where, as we're interviewing students, how important that this research means. I mean, they feel the weight of this process. It's my future in one click. I mean, they understand how important this is. And so then we talk a little bit about Valerie and about how she's a high school student from Bay Area. She's a first-generation student. So this is the first time in her family that someone's going to go to college. Her father's unemployed. Her mother supports the family. She participates in this nonprofit program that mentors kids and helps them through getting through application process, and she wants to be undeclared. And so ending on this is just sort of thinking about, again, allowing us to put a face to that unknown user who's interacting with our systems, for us not to speak for them, but for them to speak for themselves and advocate for themselves, for us to be aware of the language that we're using, so that when we talk about things like, are you in a home that's headed by a single parent family, that a 17-year-old actually understands what we're meaning by that, because most of them don't, and they have to run and ask somebody else. We want the application to feel empowering. We want them to feel like they can complete this on their own, that we don't want them to give up thinking that they're not smart enough to get into the University of California, any one of our campuses, simply because they don't understand the language that we use. So this is just an example of that, how we've applied that methodology to a project as large as Apply UC. Now, of course, let me go back to our first point. It takes a village. So while the research portions of this project have completed, now what we're doing is providing some solutions around some of the things that came out of that process, which includes not only the admissions community, the directors, folks here in student affairs who are leading that initiative, but also the back-end teams like the Apply UC team. Alan, Erica, William, Daniel, Shwetha are now pulled into the larger village, and front-end developers like Iman and Alan. I mean, our village continues to grow as the further down we get into the process. It's not just about the front-end pretty pieces, it's about all the back-end processes. It's about all of the data exchanges between the campuses. Us as IT professionals here at OP, but also sharing that data down with the IT professionals at each of the campuses. So that's it. I think that's.
We have time for one question.
Questions? John.
How many students did you actually interview for this study?
Good.
Repeat the question for the
Sure. The question was, how many students actually received an in-person in-depth interview? 17. From all of those various categories, from first gen to out-of-state students to high-income students, low-income students. Thank you.
Okay, Candace, thank you very much. Okay, so 2 orders of business before we break for today. I'm going to do the first one because I know people in the virtual audience may be running off. We have a tradition at the senior management teams that we have here at Office of the President. We start off our senior management meetings with we call it a customer story. I would say 80% of the time it's a positive customer story. There are times when someone sends up and says, hey, I actually have a negative experience I want to share with the group, so it's something we talk about. But 80% of the time it's talking about someone within our IT community who's gone above and beyond the norm from the customer's perspective, and they want to write something good or share something good about that experience. We're going to recognize one individual from our ITS team here today because the OP leadership identified him and reached out and wanted to talk about his dedication and his support and his commitment to excellence. And so I'd like to call up just real quick and present the certificate to Terrell McQuitta for his dedication to supporting our mission. And just, Terrell, just remember that there's a thundering applause out there in virtual land.
Thank you very much. I appreciate it. Thank you very much. Thank you.
All right. You got it. Great job, Terrell. All right. So we do have maybe a couple of minutes for questions overall. We just kind of, this is an open Q&A question on any topic, whether it's something you heard in one of the presentations today or in general. Again, people from the virtual audience can send in to the email address we gave you and we'll see it here. But are there any questions that people want to ask before we close for this quarter? All right, that's very good. I get off easy this time. Okay. Well, again, we want to first of all thank our speakers very much, especially those who traveled long distances to get here. Thank you. We think it's really important in our IT community to connect back to the mission, and you all did a wonderful job helping us remember why we do what we do. To everyone across the community, I want to say thank you for all that you do. As for those of you who were able to be at UCCSC. We had a great time there. We had about 350 people in total there. Chuck Rowley kicked off the week with a fantastic presentation, connecting back to the mission and also talking about us at the university. And I'll use the 7 words that I use as part of my presentation, which is congratulations for doing what you do every day. Thank you for doing what you do every day, and let's do more together. So thank you very much. We'll talk to you next quarter.